Do I need that microphone? Do I need the microphone?
Yeah.
How's this? Better? I'm going to try this. That's what I'm afraid of. Okay. Tanya Hassel. Thank you for having me here today. Hopefully I'll be able to provide you with a little bit of oversight over what we think is a fabulous and exciting new building. Can everybody see that pretty well? The lights? Do we need to dim the lights a little? Trying to make this stop blinding. I don't know. What if we turn it on? Otherwise, I'll just yell. Can you hear me if I try not to use that? I'm afraid that the feedback is too much. I can actually talk quite loud, so it's most of the people around. So this is a picture of the new campus. You can see Route 1 that runs along where you see this pointer. You see the hospital, the main patient tower, the campus. So if we are looking in this direction, we would be going north. Everybody get that part? Up here you see Scudder's Mill Road. Down here, in this area, actually this is it right here, is Plainsboro Road. Plainsboro itself is out sort of this way, back this way. I have actually aerials of the whole campus. So let me just tell you a little bit about what you see here. You see the lake in front. We call that Lake Rabner. That's a joke. And, actually, Peter and I call it Lake Rabner. But it's a detention basin. It adds a beautiful campus-like environment. All of the rooms in the front of the hospital will face out to that. What you see at the bottom down here are a number of buildings. This picture is probably, judging by it, I'd say it's about 3 months old. We don't take them every week, but it's about 3 months old. These buildings, most of them right now are gone. And this is going to be turned over to Plainsboro for a public park. It'll be very beautiful. Right at below the screen would be the Millstone River. So it's quite a beautiful setting for it. This is now an aerial of the back of the building. So, oops. So what you see here is the back side of the patient tower. Again, you see Route 1 running north and south. You can see the improvements they made on the bridge here. The Millstone River runs through here. You see the pond. Again, this whole area down here will be a public park. And it creates a beautiful campus environment. The entrances on Route 1 to the campus, one of them is right here at Plainsboro Road. And I have another picture where it's a little better to look at than this. And you come along and enter into parking right in front of the hospital. Ambulances will come up this way. They're coming this direction. Will come up and enter right here. Special ambulance entrance. This area is the emergency department right here. Actually, this building you see here that I'm trying to draw around here is on the first floor is the emergency department, radiology. The second floor is surgical. So what you see here on this picture is the back side of the hospital. There are 231 private rooms in the new hospital, 6 stories. You see the diagnostic and therapeutic building here. You see what we're calling the education building, which has lab, community education centers. Our clinic is actually on the first floor here. There are a lot of administrative offices in this area. What is on this end of the building is actually a replica of this. It's a health and fitness center. Princeton will be a partial owner in it, as we are in this site where we are today. It will be open at the same time as the campus. This building here, large building here, is a 5-story medical arts pavilion. The hospital will occupy the first 3 floors of that. First floor of that will be radiology, outpatient radiology. Second floor will be 4 outpatient operating suites at the surgery center. The third floor will be physician offices. The remainder of the building will be private physician offices, so a lot of presence on that campus. This building here is a power plant. One of the things that's unique about this campus is we have the ability to generate on campus enough power to supply not only this campus, but to sell it back to the grid. So it's one of the energy efficiencies of this new design. Parking back in this space, largely for employees. Patient parking will be out in front of the building. I'll show you that piece already. The emergency department is right in this area here. If you've been to our emergency department, you have a real good idea. The current emergency department, you know why we're building a new hospital there. This is actually an amazing space in here. David may talk about it a little bit in his presentation, but we have a geriatric section of that for seniors where it's really designed for the special needs of senior citizens. We have a psychiatric section of that, and we also have a pediatric section. It is probably 3 to 4 times the space of our current emergency department. So very large, very spacious. One other thing, Peter would yell at me if I didn't point this out. Right here where I'm pointing to is our cancer center, new cancer center in the new hospital. It has 1 linear accelerator, capability to go to a second one. It brings together the chemotherapy service as well as the radiation therapy service into one location. It really creates a great center. The chemotherapy area is on this first floor and along these windows. This will be made into a garden out here. Again, this is a winter picture, a late fall picture, but this will all be made into a sort of a healing garden out here. So people who are here getting chemotherapy will be able to look out into that, into a very nice space. All of these buildings connect to each other on at least 2 floors, so there's a lot of ability to move between buildings. This is just, again, going counterclockwise around the building. You can see the Health and Fitness Center is over here. Building 2 is back here. The Medical Arts Pavilion here. This is the power plant. You can't see much of the emergency department and diagnostic, but you get a sense of the curvature of the building. And you can see right here is where the ambulances come off and enter into the campus. This is what the front of the building looks like probably about 2-3 months ago. Obviously a very spectacular building. I don't know whether they doctored that picture up or whether they actually get the sky to match the front of the building, but it's a pretty picture. We show it a lot. That would be actually standing in front of the lake, looking up the hill towards the hospital. You can see the fountains. So this is what it looks like once you enter it. Let me just go back here. So people will enter the building, people that are driving up to access the building, the hospital building. Now, if you're going to the Medical Arts Pavilion, you'll go on the back side. But if you're coming into the front of the hospital, you enter through 2 points. I mentioned the Cancer Center earlier. It is right along here on the ground floor. So people can enter at this point, or they can enter at this point. 2 entrances. Why do I show you that? Because that's what they look like. So I would be standing at the right side of the building, the east side of the building, looking down the corridor. This is the main corridor of the building. That is actually what it looks like. This is not a drawing. This is actually what it looks like. So what you see here is, I would actually be standing probably pretty close to where the Cancer Center would be in this picture. Right here. Yeah, does that look right? I'd be about right here is where I'm standing now would be like in the Cancer Center looking down the hallway. What you'll see down here are a number of what we used to call portals. They're entryways. And down here there are 4 different entryways, as there is one for the Cancer Center. And they are disease or specific. So there will be one down here for surgery. There will be one down here for diagnostics. There will be one down here for cardiopulmonary and one for neurosciences. And what we've done is, as you enter through these, coming from the outside again, entering into those, everything you need for diagnostic and services, you'll be able to access through there. So when you go through, I think it's this portal here, for surgery, you'll go through, all the information will be taken. There's an elevator that goes right up into the surgical suites. So it's a concept that we think is is great for people accessing the building. This is an example of what the floors look like right now, obviously. You can still see it's under construction. I think this is a critical care floor because of the size of that door. It's most likely that. You'll see you can still see the curvature of the building. Again, every room is private. That's a big plus for us at this point. One of the other things we've done, you can see it in the next slide I show you, is we've made the doors to have big glass panels in them. One of the reasons is it brings light in from the outside, so even in the inside of the building you get a lot of sunlight. A typical nurse's station, on the medical surgical floors, there are 3 of these per unit. Our intent is to get nursing care and patient care as close to the patient as possible. So we've broken up the units into 3 different sections so that the nurses are as close to the patient as possible. One of the other things that I'll show you about the rooms. This is actually a sample of the room, one of the rooms. The rooms have 3 different zones in them. What you see here is actually the family zone. There's a computer station, large screen television in the room. One of the things we'll be implementing is something called the Get Well Network, which is interactive with the patient, so they can order meals from here, they can get educational material from here. There's a lot of things that we'll be able to do of a pretty high-tech nature with patients. It'll, over the first year, we'll get it installed in the rooms. It'll be brand new to this facility. But, so here's the family zone. You see a work area here. You see a couch here that converts to a bed, so that if people want to stay, they can. We will have unlimited visiting hours in these areas, and we will encourage family members to be part of the care that patients receive. This is the looking now in from that family area where I showed you. So I would be right over here now looking at the room. There's what the room will look like. So let me show you the other 2 areas. This area here around the bed and everything that goes with it is obviously the patient area. There's a specially designed head wall here that allows us to get services. You can see some of them back here on the wall mounted and as close to the patient as possible. These beds, we actually own these beds now, and we'll move them to the new facility. And Dr. Burley may talk about it. It's particularly useful for seniors and people at fall risk because these beds can actually be lowered to 18 inches off the ground. It's been made a huge impact in us reducing falls. One of the other things about this room, we've done a lot of research and best practices in what causes falls and how to reduce infections in a hospital setting. So one of the things you see here is this is the bathroom. There's actually a sliding door. When that's closed, you can't see through it, but light can come out of it. One of the problems that patients have at night, particularly when they get disoriented, is they can't find the bathroom. They don't know where it's at. So patient here, you can't see it here, but there's actually, you can see it right there. There's a handrail that is there. So people getting out of bed have a handrail to lean on and hold on to as they try to get to the bathroom. The toilet is actually right inside that wall. As I mentioned, glass in the door. It will be slightly tinted, so the light will go out into the hallway, so there's more of a sense of being in the outdoors. And the third part of the room is the nurse area. So what you see here is a wash station immediately as people come in the door. One of the biggest causes of infections in hospitals is people don't wash their hands. So right inside the door is a sink, place to wash. This area here looks like just a plain wall. It's actually not. It's called what we call a nurse server. And what we're doing is we're bringing supplies, medications, and everything, and we stock this area. There's a door. You'd have to look into it this way. So there's a door. There's a set of doors on this side. Nurses can get everything they need for that patient, whether it's med-surg supplies, whether it's linen, whether it's medication, will be in this room. So nurses can spend more time in the room. It also is stocked from the outside of the hallway. So it reduces the number of people coming into the room. Again, an issue for infection. The flooring, everything is designed so that it reduces infection, it's not porous, adds for easy cleaning. So you get a sense of the room. Some of this part we probably will not have in the room. We might not even have that, but you get the idea of how it works. So 3 zones to every room. Now, this is what an operating suite will look like. Again, these operating rooms, let me just take a look back. For the most part, what we've done, with the exception of our critical care rooms, we've designed all rooms to be the same. All of them have cardiac monitoring capabilities. So there's about 170 some of the new rooms, the 231 rooms, are all the same. So we can move people from one area to another, we can monitor people, that way we keep actually from transferring them from unit to unit. And so it gives us a tremendous amount of flexibility. It also creates familiarity for physicians and nurses and others who go into those rooms. They always know what that room looks like. It's always going to be the same. Stuff will be in the same spot in the room. So again, people being familiar with the space in which they're working reduces errors. Okay, so this is what, and this is really an artist rendering. This is from the manufacturers because these rooms do not, as of this moment, have all these in it. But let me just tell you a little bit about these. So this is what a typical operating room would look like. It is large. It would take up 2/3 of this room, 650 square feet. It's a very large operating room. The reason that we make it so large is because there's a lot of stuff that goes into operating rooms. A lot of things get wheeled in, a lot of things get wheeled out. One of the things that's very different about this design are these booms that you see from the ceiling. They're all mounted up in a central point, and then the booms are movable. So for all intents and purposes, a surgeon in that room can reconfigure this room to any way they want. One of the problems that surgeons have a lot of times, particularly if they're left-handed, is most operating suites are right-handed. So if they're left-handed, it's not that convenient. So these types of rooms allow them to reconfigure to any form they want. It also keeps things off the floor, cuts down on trip hazards. You don't want somebody falling in or it's not a good thing. And it allows us to mount all kinds of devices from the ceiling. They, again, are state-of-the-art. I can't imagine that there's any technology that we don't have in them. They will be connected through what a system, it's called Black Diamond is the name of the system. It allows for us to transmit images to pathology. So a pathologist who's looking at a specimen can actually see what's going on in the case. Actually, the cameras are mounted up in these lights. We can use it for teaching purposes, just about as high-tech as you can possibly imagine. So that's the hospital. I wanted to do one thing here because somebody gave me this the other day. I call these fun facts. It's about how much of stuff is in that building. So this could be on your next Trivial Pursuit game. So there are 417.5 tons of ductwork in this building, this hospital. There are 31 miles of copper pipe in the building. And I've seen a lot of this area before we're done. I believe that that's true. There are 296 miles of wire, and that's not for the IT stuff, that's just electrical wiring. 9,700 electrical light fixtures. There are actually, even though there's 231 rooms in it, there's actually 2,800 rooms in the building. So offices, everything like that. Good news is there's 1,500 parking spots, which you know we don't have now. So we're happy most about that one. So I want to finish, I would be remiss in not finishing with a couple of comments about quality. And then I'll be happy to answer any questions you want about the new facility and the way things work on that. At Princeton Healthcare System, we think we have a very special mix of physicians. You're going to hear 3 of them today. I know all of them quite well. They are excellent physicians. They will serve you well. And we're really proud of our nursing staff and the other folks that provide care at our organization. You probably know we've been nationally recognized for that. 2 of them awards are actually up here on the screen. The Leapfrog Group. Leapfrog Group came about through industry, actually, and there was a conversation amongst very large companies, probably Fortune 50 companies, about how do we know we're getting value for the healthcare we buy? We're large purchasers of healthcare. So they began to look at things, best practices that had been established, and began to develop what they call certification for hospitals, leapfrog certification. Things like having intensivists, intensive care physicians in the intensive care unit at least 8 hours a day. We have them 24 hours a day, but at least 8 hours a day. Having computerized order entry for physicians. We've had that probably since the early 90s. There's a number of other criteria that they have around best practices. For 3 years in a row, University Medical Center Princeton was recognized as a top hospital. I think in 2010 there were 48 other hospitals recognized. They would be names you know, Mayo Clinic, Mass General, Stanford, Hopkins, those types of organizations. We are the only hospital in the state of New Jersey to be named that 3 years in a row, so we're pretty proud of it. I think it's a real accolade to the medical staff and the rest of the staff at the organization. As part of that, Blue Cross Blue Shield of New Jersey, better known as Horizon, recognized University Medical Center Princeton as the top hospital in the state for quality outcomes and its quality measures. So we're obviously very proud of that. Another one, and we just got this award, hospitals in this country are surveyed and certified by an organization called the Joint Commission. It's been around for a long, long time. Almost every hospital in this country is surveyed by them, so it's a big number. It's about 4,000. And they look at a number of process-oriented things. For heart attack, there are about 7 or 8 things that are proven to be best practices. Giving someone an aspirin, counseling them on smoking cessation. For surgical care, there are about 15 items that if you do, it's known that you'll have a better outcome. We've scored 100% on all of these, and that puts us in a group of about 450 hospitals nationally that have also scored that and have been rated top hospitals. There's only 12 of them in the state of New Jersey. So we're pretty proud of that one too, because that's taken an awful lot of work to get to that. The other 2 areas that I want to mention, obstetrics and joint replacement. There's an organization called Health Grades. You might know if you listen to me talk long enough, there's a lot of people that evaluate quality in healthcare and a lot of regulations. So it's not always easy to meet all of these. There's a lot of things going on. One of them is Health Grades. They rated our maternity program and our joint replacement program as a 5-star rating. That's as high as you can get. For maternity, it's been 7 years in a row. For orthopedics, it's been 5 years in a row. So very good programs, things we're very, very proud of. And with that, I'll answer questions. Yes?
How did you choose yellow as the color, or is that just across
For which room? I don't know what that means. Yeah. There's. I think they. I'll tell you this though. Colors go in waves. Like if you were back in the 70s, they all had the 70s look to them. You'd know that if you saw it. And then they went through this pastel colors, and now we're back to sort of primary but softer colors. I know there's research about the colors, but I wasn't there for that, so I can't tell you. It's a good question. Others?
If I want to approach the emergency center, do I have to use the back road or?
Well, there's 2 ways to get into the campus. You can be coming up Route 1 here, so you could enter the campus here, and you would go. There's an entrance here. There's also another one down here. Okay, so if you're coming off Route 1, you'd be down over where the pointer is off the screen. You can come across Plainsboro Road. You can enter the campus here, or you can come down here. This would take you right up to the front of the building. If you're going to the emergency department, you can stay on this road around here and come right back. This is actually the parking lot. Or if you're coming from out here, sort of Plainsboro, you would come along Scudder Mill Road. Let me see. You would enter up in here. There's a connector up here. I think this is called Connector Road out here. And this is Campus Road. So you would come down this, you could come across this back road, and then you could A couple of important dates I did fail to mention. We get, as the buildings are finished, we get control of it. The Bill Turner Construction Terms and Villages. This building 2 will get control of next week. It's important for us because Everything on this campus runs on IT systems. I say it runs on electrons. Everything is automated. It's a very technically sophisticated building. We're putting our data center in this building on the second floor. So we need to get that in, get it tested, make sure that everything works to keep that running. This building here, the main patient tower and the diagnostic area, we get possession of that. We close on that on March 15th. So what we will, and then this back building here we get on May 2nd. So those are the big dates for us. We will move and stop doing patient care on May 22nd of 2012 on the current campus and move to this campus. Between March 15th and May 22nd, we will move as much as we can other than patient care items to this new campus. So we'll move the lab, we'll move some of radiology, we'll move people like my offices, other things, medical records. We'll get as much out of the current Witherspoon Street campus as we can and into this building. What we'll also be doing is we'll be doing training and testing of this new building. I will tell you that I've been doing this for about 33 years. I have never seen anything more complicated than moving to a hospital. It's really complicated. And you have to do it right, you have to rehearse it. We have probably 2,500 employees that we need to train. They need to know how this works when we get there, so that anybody who comes to us is safe. So how it will work then, May 22nd is actually a Tuesday. A lot of people say, why would you move on a Tuesday versus a Sunday? The best reason is because when you move, you have to make sure that everything works. You have to rely on a lot of your service folks, like elevator operators or anything like that that could break down during the move. Because once you start to move, you have to keep going. You can't slow down. So Tuesday's a better day for that. Tuesday we have more staff around. Traffic, it really doesn't matter. What we'll do is reduce the census in the current hospital to about 100. We'll then get all of them ready, and one by one we'll start moving. We'll move somebody about every 9 minutes. It's actually on the Princeton side of things very quiet. We just take them down by ambulance and drive away very quietly. Over on this campus, though, I'm sure there'll be a lot of commotion with it as well. But on the Princeton side, it'll be pretty much a non-event. We have an agreement of sale for the Witherspoon campus. The intent, now they're going through approvals now, but the intent will be to build apartments on that, to basically knock everything down with the exception of the red office building that you see on that campus. Parking garage will also stay. Actually, the parking garage is probably the most valuable thing on the campus because they're just too expensive to rebuild. Their intent is to put apartments on that campus. How many? They're still in negotiation with the borough. And so they will probably take possession of that in December of 2012. So we'll continue to operate and own that building until then, although we won't provide patient care. Yes?
If we come up with an emergency at home, where do we go in your moving transition? Where do we go for?
Well, up until 9 a.m. on May 22nd, you come to the Witherspoon campus.
Witherspoon.
That will be closed at that point in time. That's the first thing actually of the move that we do. We close the emergency department, and as I said, right here. And see, that's one of the groups that we have to train, the emergency responders. And they already know. We've had them actually begin to tour the building. They're thrilled with it. Other questions? Yes.
Do you have any particular plan for the traffic congestion during the rush hour?
We're going to ban cars. Actually, there's a couple of things. There's one thing that's interesting about this campus. In moving to this location, we're actually closer to 70% of the patients we served. You may not think that if you live on this side of Route 1, but we actually are. So one of the things that is going on, and I can't show you on this, Harrison Street is the area we're most concerned about. And the state has begun work already on that. They're going to make a right-hand turning lane, and they're doing something with the lights that gets it down to, at its worst, no more than a light and a half delay in getting through that intersection. One of the things we did talk about is some kind of overpass over the road, over Route 1. That's really a state determination. You can ask them. So given the state of New Jersey and its financial condition, you can imagine what the answer to that was. Because I forget what it costs, like $400 million to build an overpass. It's some insanely large number. So they're not willing to do that. That's as good an answer as I have. Anybody else?